Hi, my name's Lexi, or most of you know me as Fatgirlfedup, and today I actually am joined by Dr. Joseph Michaels, who is going to do my skin surgery. If you guys don't know, I am going to be getting loose skin surgery on Halloween. So I guess we'll just start by, who is Dr. Joseph Michaels and where are you located?
I am a board-certified plastic surgeon. I am located outside of Washington, D.C., and my specialty is after weight loss skin removal. I did a fellowship specifically trained to do that type of surgery, so it's a real passion of mine, and I've treated over several hundred weight loss patients, and it's just awesome to help Lexi on the back end of her weight loss journey, because this is just such an important part to just help them really realize how far she's come with her amazing weight loss.
Thank you. And a lot of you asked me why I chose him as my surgeon. I've been silently creeping on you for a while. There's actually a lot of Instagrammers that I follow, and I saw their transformations, and I was like, who is this guy, and how is he a freaking magician? So I was super excited when I finally was like, okay, I have to do something, and I did a lot of research because I've always been kind of scared of doctors. I'm not scared of you, just so you know.
Appreciate it.
And I just felt super comfortable. I don't know, I just trust you, and I was really excited that we are going to work together. So
It's going to be great.
yes. The question that one of you asked me was when I gained all my weight. I have been overweight my entire life. I have carried my skin all the way until I'm 27 years old. Like, there has never been a point in my life where I did not have a stomach, where I did not have any skin rolls. Like, I've always been heavy. And another thing you guys asked me is my family's thoughts on me getting surgery. A lot of them are really excited for me. You know, they just want me to not be in pain. They just want me to do what's best for my body. They weren't pushing me to do surgery. They just wanted me to choose. So Danny's mom actually is going to help Danny with my recovery. And yeah, I mean, they're scared. Danny's scared. I'm scared. But it's just something that we're also excited about because it needs to happen. And then somebody said, I have a lot of excess skin due to significant weight loss. What pain do you experience? So I have a lot of like pulling. I just feel a lot of pulling on my neck. My posture is off. I don't sit where I should be at all. And I've just been dealing with it since about February, but I didn't really realize it was my skin. And I went to the doctor, and I was like, just a convenient care clinic, and I was like, I'm having pain. I feel like I'm being pulled forward. I don't know what's wrong with me. My neck hurts. It's like almost a pulling. And the doctor was like, oh, it sounds like you might have sinus issues. But doctors don't deal with that. They don't deal with loose skin every single day. So I don't know. So that's where we're at right now with that. And then a question for you. The procedure is going to be done, so they want to know first what surgery I'm having first. And what areas of my body it will cover.
So what we've spoken about is doing something called a lower body lift. And a lower body lift is the biggest procedure that we can do to basically reshape your trunk, which is basically a circumferential area. So a lower body lift is going to take care of your tummy. Will tighten your muscles as well. It's going to help your outer and anterior thighs, not so much the inner thighs, but it will have some effect, and as well as your buttocks as well. And one of the debates that we've spoken about is there's a variation where there's a vertical incision on the belly to help remove skin in a direction sort of towards the center. And I know for a lot of my patients and yourself that cosmetically, you know, having a scar on your belly is something that, you know, we're going to both talk about more. Because I think that's an important decision. But it's something that if we don't do, we can always do later on. But that's sort of the main procedure that we're doing is something called a lower body lift, or a circumferential lower body lift, or a 360. It's got a lot of names that are sort of floating around, and they're sort of used interchangeably. But that's basically, you know, what we're doing.
Exciting. So they also want to know if the surgery will be done via multiple operations, or how they're spaced apart, or if I could have one large surgery, or just where are we starting? What's our game plan?
So the game plan for, I think, this first surgery, and a lot of times for a lot of weight loss patients like yourself, they have a lot of areas that they want to get corrected.
Everywhere.
And you can't do it all at once. And there are a lot of reasons for that. One is because it's not safe to do, 15 hours of surgery at one time. But it's also because when we pull your skin in different directions, they actually sometimes pull against each other. And so we want you to be as tight as possible. So we don't want to do one operation that's pulling this way and another operation that's pulling that way, because it's just going to help you, not make you as tight as possible. So for the first surgery, I think we were going to plan on basically staying sort of on your lower body, taking care of that first. And then some future stages, doing your arms and possibly your chest and thighs and some other areas. As they say, Rome wasn't built in a day.
Yeah.
So, and you didn't lose this weight, right away. So it's a process, and it's just a lot of times safer to do these surgeries. Although everybody wants them done at once for a lot of reasons, it's, a lot of times best, especially given the amount of weight loss that you've had, to really try and spread these surgeries out to sort of give you the best result.
Yeah, because I have loose skin all over my body, so I was like, okay, I'm sitting forward, like I'm gonna have to do something with my boobs, my stomach, like where do I start? And that's where he kind of was like, okay, Lexi, this is what you need to do. So talk to your doctor and start there is what I would recommend. So what they want to know is when my surgery is scheduled. That is Halloween.
And we didn't do that on purpose. It's just how it happens.
I'm gonna be a mummy, so it'll be great. And then my recovery time. I got asked a lot about recovery, about going back to work, about working out, like what the process is really to recover.
So I'll give you some sort of general answers, and then obviously since you're coming from out of town, there's going to be some unique, proper, situations for you. But in general, patients who have a lower body lift will stay overnight for one day in the hospital. We'll send you home the next day. We want you walking that evening, and the next evening we want you moving around. We don't want you to get blood clots or other issues like that. The lower body lift is definitely one of the bigger procedures that we can offer, and so patients usually take off from work a good 3 weeks. You can do some, obviously, walking, moving around, some light lifting, but nothing really heavier than a gallon of milk for the first couple of weeks. And that's going to be a big change, an adjustment for you for sure. The first week or so, you're not really going to want to do very much anyway. All my patients have lifting restrictions for about 6 weeks, so at 6 weeks you can go back to the gym if you're ready. You can start doing some core exercises, and honestly, that's one of the hardest part for my weight loss patients, because they're really, very into their diet, they're very into their working out, and it's a really sort of abrupt stop to what their life is really becoming. It's a real challenge for a lot of patients, and that's sometimes a little bit of a tough, adjustment. For patients like yourself who are coming from out of town, we sort of modify things a little bit. I have patients come in a day or two early if they're flying. I want you to come in a day or two before surgery to minimize your risk of blood clots.
Okay.
And I don't allow patients usually to fly after a lower body lift for about 10 days.
So I'll have to stay in Maryland. I'm going to Maryland from Indiana, so I've never been there before. I might have to get a crab cake.
We'll show you a good time. Absolutely.
Let's see. So the next question is, what if you continue to lose more weight after your surgery? We'll just start there, actually.
Sure. So ideally, we want patients to be sort of close or at their goal weight. And the reason for that is, no matter how tight you make a weight loss patient's skin, it always stretches out. I mean, that is just what skin does. It's the reason why women can get pregnant and their bellies don't burst. It's the reason why you were able to weigh as much as you did,
485 pounds,
and not have basically your skin totally split open. So, in terms of getting, God, I totally blanked on the question there. I was going
you're fine. We can always edit.
Yeah.
Can you continue to lose more
continue to lose weight. There you go.
We're not perfect.
It's early. Try to do this in one take. So after surgery, ideally you don't want to lose a significant amount of weight. And what I mean by that is you don't want to lose more than, 10 plus pounds, because the reason for that is that as you lose weight, your skin is going to loosen up. And as a weight loss patient, your skin is going to loosen up even more than if you weren't a weight loss patient. And the reason for that is that the proteins or elastins and the elasticity of your skin is not as good as it used to be. So your skin's not going to snap back. So ideally you want to be at or close to your goal weight. And we get these questions a lot. A lot of patients want to come in and they want their, they want the surgery sooner than later. And it's really important for patients to know that if you really want to get the best cosmetic result, you should be at or close to your goal prior to surgery, because losing a lot of weight afterwards can compromise your result.
Yeah, that definitely makes sense. And then they asked, what will be my nutrition recommendations for before my surgery, and for like inflammation? I know you had said to eat like a certain amount of protein, and then maybe after surgery, is there any certain things that I need to do with my diet?
So for the most part, protein is the building blocks of healing. So we really want patients to load up on protein, be around 80 to 100 grams a day. And the reason for that is because protein is sort of a bigger molecule, and what it does is it pulls all the fluid out of your tissues into your blood vessels, so it minimizes your swelling, and it also provides all the building blocks for healing, such as collagen formation and other things. So it's really critical to make sure your protein levels are good beforehand. Vitamin C and zinc are also really good for healing, so we want those levels high. And after surgery, it's really just getting in protein any way you can. Most of my patients are not extremely hungry after surgery. There's a little bit of discomfort. They're also on some narcotics afterwards, which can sort of affect your appetite. And so it's really important, just sort of like running a marathon, you got to just sort of load up and get everything sort of on board beforehand, because afterwards you're going to sort of go through it a lot. And then obviously after surgery, like pumping the protein and things like that are really important. Low salt as well to minimize your swelling.
Oh yeah, especially my swelling. And then what are the risks with such a big surgery?
The risks with any surgery, unfortunately in life nothing is for free. The two most common complications that we see in weight loss patients, and they're a little bit of a higher risk than sort of the non-weight loss population, is healing issues, and one is some of the protein and some of these other things that we spoke about. But if you think about it, if you're doing an incision that goes all the way around, you're going to have about 3 to 4 feet potentially of incision. And so the likelihood of one small little area not healing, is not uncommon. And so that can sometimes happen up to 30 to 50% with a little area that just doesn't completely heal. And it generally will heal on its own with a little bit of antibiotic ointment. That's the most common issue that we see. The second most common thing is something called a seroma, which is a fluid collection. And I know one of your questions, or people were asking you about drains. Are you going to have drains?
How long I have to have them, and
Exactly. So for a procedure like this, you're definitely going to have drains. You're going to have 2 drains that basically crisscross and drain your abdomen as well as your back. They stay in on average about 10 days, give or take, sometimes a touch longer, for a procedure this big.
So will I fly with those, or I know you said I have to stay 10 days?
The goal is to get them out before you leave.
Okay.
Otherwise, Danny's going to be your ride horse.
Danny's got my back.
He's looking at me like, what's going on?
He's like, okay, all right.
Other complications that can happen are, things just really, typical of any surgery. Infection, bleeding, scarring. You're going to have a little bit of numbness on your belly that will get better, but you'll always have some numbness on the skin. Obviously they're very significant, but rare consequences of surgery as well. Blood clots, and we're going to have you on blood thinners and get you walking around.
Well, that's the thing, is it's a surgery, and a lot of people would come to me and they would be like, Lexi, why don't you just go get it removed right now? And I'm like, it's a massive thing. Like, you definitely have to think about it. You can't just jump into something like that, because there can be complications, but like you said, with anything. So yeah, definitely a good question. I got that question a lot, actually. What is the average cost of this surgery, and are there payment plans? Like, is there anything you recommend for saving? Like, how much does it usually run? Is it covered by insurance? A lot of people are focused on the cost, obviously, too.
So there's a lot of variabilities that go into the cost of this type of procedure. It is sort of the biggest procedure that we can offer, and sort of for that reason, it's also one of the most expensive. So Insurance unfortunately doesn't cover a lower body lift, but they will sometimes cover something called a paniculectomy, which is sort of the lower apron hanging part. And so for patients who are having medical issues related to their skin that have been documented by their doctors or other healthcare people that are sort of taking care of them, chiropractors sometimes, or other things that are sort of documenting these issues, we can get insurance to sometimes cover that. But unfortunately, sometimes the insurance companies don't, it's not actually even a covered benefit under their particular plan. So if it is covered, we can do something called a hybrid procedure where we get insurance to pay for the lower removal and the patients pay for the rest. Each procedure is really going to be basically customized to the patient's needs. And so when we do cosmetic surgery, the fees are basically based on how much time it's going to take, because it's basically charged on a time basis.
Okay.
Every fee has 3 fees. There's a surgeon's fee, there's an anesthesia fee, and there's a hospital fee. The national average is, for these procedures is probably around 15 to 16,000. Geography definitely plays some role in that as well. Certain areas are a little more. In the Washington D.C. area, the average price is probably around 16 to 17,000 with everything. And there are payment plans available, or financing, or other options like that available.
I know somebody asked me if they do a payment plan, do they have to put like a certain amount down or half down, or how does that really work?
I think that's really going to vary by particular practice.
Okay.
I can tell you in my practice, the hospital and anesthesia need to be paid in full up front. That is their policy. I don't do payment plans personally. We do financing, so you can have a payment plan. But there are a lot of options available.
Okay. Well, I know that was a question that a lot of you asked, so hopefully that helps with that. And then here's a fun one. We should take bets. How much loose skin do you think you're going to remove from my body? I know you still have to really examine me kind of, but do you have any guesses?
Skin and fat don't weigh as much as everybody thinks it does. I think the really key critical, number is, how long is that skin? I mean, we're probably going to really remove, almost a vertical 1.5 foot of skin. And when you sort of put that into perspective to your height, that's an incredible amount. So the number doesn't always mean as much, but I think, in terms of total weight, I think you're probably going to end up around, with everything moving, probably between 5 and 10 pounds. Now, I know that's not the number that you maybe not wanted to hear, but you also got to remember, for you specifically, one thing that we're going to do, a lower body lift by definition sort of flattens your buttock, and that's one thing that we sort of spoke about. We're going to actually try and preserve some of that tissue in your back. So we're not actually going to remove everything, we're actually going to repurpose it. And so for that reason, and what that's going to do is hopefully give you some better buttock shape and some buttock projection, because when you lift that skin up in the back, it sort of has a tendency to really sort of give you that flat buttock appearance. And for a lot of my patients, they want to have some, curves are good.
Yes, I need it.
So, we want to sort of preserve that tissue. So you're sort of getting a false number, because we're actually not actually removing everything. We're going to repurpose it. We're recycling. It's like a green procedure.
Yes, that's exciting. I personally felt like I had 20 pounds, but I don't know. But I know my body, and I know that I have skin everywhere. Everywhere. My neck, my face, everywhere. But it's okay, because I'm healthy, and that's what matters most. So
I think when we add up all the areas eventually, I think you're going to sort of get close to that.
I agree with that.
I think when we started just talking about this one area, it may not be as much, but I think when we sort of start adding up all those numbers, I think it's going to really climb.
Because people are like, are you going to weigh less after surgery? And I'm like, yeah, I have skin. I have a lot of skin. I don't know that it's going to be drastic or anything, but it's definitely going to be different. So, and then a question a lot of people actually ask me, do any products or exercises work to tighten the skin?
It's a great question. I mean, there's definitely no products that are going to help. I mean, how your skin responds to weight loss is really going to be, again, patient dependent. So, younger patients who have not had a lot of yo-yo dieting back and forth, where their skin has sort of gone, up and down, up and down. It's sort of like a balloon, the more you stretch it out, it sort of goes back, but it sort of loses its elasticity and sort of looks wrinkled. It's sort of the same with the skin. So if you've lost your weight, just once or twice, your skin's probably going to bounce back. Genetics obviously are going to play a big role in it. If you have good genetics and genes, and you're going to obviously do better. Younger patients generally, again, do better. And also sort of the speed at which you lose your weight will have some effect on it, because if you lose it sort of slower, then your body has a little more time to accommodate. If you lose it very quickly, or some patients who have had bariatric surgery, they're losing a significant amount of weight, especially at the beginning, very quickly, and so the body doesn't have time to adjust. So there are a lot of different factors that are going to come into it. Obviously, building muscle, tightening your muscle underneath is going to help, but you can't exercise your skin. You can exercise your body, you can exercise your muscles, but you really can't exercise your skin. So there's not necessarily any magic or any sort of preventative, possibilities for that.
Yep, makes sense. And when should you start considering surgery? Do you have to be like at a certain weight, like we talked about, that you want to be kind of at your goal weight? Is there a certain amount of time that you should maintain?
Yeah, great question. So, I think there's never a bad time to sort of think about plastic surgery, but there's a bad time to do plastic surgery. And I think, as well as when it comes to the timing of your consultation, you want to be at or close to your goal weight for the reason of that you want to get the best evaluation. So, I think that if you are sort of starting on your weight loss journey, I think thinking about these things in advance is very important, and maybe putting some money aside if you think that's a possibility, so you have a longer time to sort of plan. But in terms of like going forward with surgery, I really like patients to be at or close to their goal weight. If they're a weight loss patient through bariatric surgery, I generally want them to be sort of weight stable for at least 3 to 6 months. And if they're diet and exercise, lifestyle modification, type of weight loss, you really want patients to be there for about 6 months, because you're going to have some changes. You want to make sure that you can maintain it. You want your body to sort of get back to sort of normal. Your body's been in breakdown mode for so long that you're not really ready to sort of heal some of these incisions. So you want your body to sort of be, at a good place.
Okay, yeah, that makes sense, definitely. Lexi, you're amazing. Thank you. Thank you guys for all the comments, by the way. We got a lot. We got like 700 comments.
Pretty impressive.
Thanks, guys. My followers are the best. How much excess skin is safe to remove at once?
I've removed up to 70 pounds at one time. So a lot of times there's a lot of fluid and inflammation and things like that are going on. So it's not necessarily the amount of tissue that's considered safe or not. I think it's really, doing the right operation for the right person, making sure that they're safe and optimized. And again, that means medically optimized, nutritionally optimized, and honestly, like psychologically optimized. Make sure that they're really ready and a good candidate, and having real good goals and expectations, because in the end, you have to be happy. So I don't think there's really a real limit, to how much skin can be removed. It's just about doing it safely.
And you said 70 pounds. Somebody asked if like my skin was the most you've removed, but you did like a 700-pound guy, right?
One time I operated on a former heaviest man in the world who lost 600 pounds. Not to downplay what you did.
That's awesome. That's great.
And so he was a really big case. We took off a total of, I think, almost 50 pounds in that gentleman. So
that's amazing.
Well, it's great because I have a lot of experience, and so it's been, and it's real fun for me to actually help patients like you and really sort of see, how far you've come, because the skin can honestly be sort of a stumbling block for a lot of patients. They do, or weight loss people, who've lost a lot of weight, and it's sometimes very hard for them to see, how much they've accomplished. And so for me personally, it's great to sort of share on this journey and really, help patients, sort of see how their true extent and help them with their confidence and their self-esteem. It's just really awesome. As a surgeon, to be able to help people like that is just is pretty awesome.
Oh yeah, definitely. And it's awesome for me because I feel like I'm going to be able to help people going through this journey. So
100%.
yes. And then the next question is, can you do one large surgical procedure? I think we talked about that a little bit. You said you can't really get it done once just because all the hours in surgery, right?
Right. I mean, you can definitely, I do have some patients who will sometimes do their arms at the same time as a body lift, or sometimes their chest. I think in your case, just given the significant skin excess, I think it's just best to sort of concentrate on one area.
Well, I just know personally that my body is so heavy. Like, it's going to be such a game changer because I'll be able to lift my legs, and we do jumping jacks and everything in my class, and I'm like, I'm not going to know what to do. I'm going to be like moving and be like halfway across the room because I'm not going to be so heavy. So it's going to be insane to me.
You're going to have like phantom skin.
Yeah. I've never had a flat tummy before, so I'm like, okay, here we go. And can you have loose skin surgery if you're diabetic?
So the answer is yes. I mean, as long as you're well controlled, and there's something called hemoglobin A1C, which is a real measure of how your blood sugars are doing. And so we want you to be, your blood sugars controlled. We do generally sometimes make those patients with diabetes, sometimes their surgery is a little bit smaller because they are a little bit of an increased risk of infection compared to other patients.
Oh, yeah.
And I generally will sometimes keep them in the hospital, especially if we're doing longer cases, just to monitor their procedure and their sugars. But just because you have diabetes doesn't mean you can't have surgery.
Okay. And then one of the last questions, did you ever struggle with your weight, and can you relate to those of us who have?
That's a great question. I mean, I have never honestly walked in your shoes or Danny's shoes or anybody else who has been over 100 pounds. What I can tell you is that I've taken care of hundreds of weight loss patients. I've really learned a lot along my way from all my patients.
Oh,
and
yeah.
where I actually learned the most actually was I do a lot of support groups, and I would always go to the after weight loss because that's when I sort of spoke with them. But I went to one support group or a couple of support groups where it was combined. So there were people that were there beforehand, before their surgery, debating about surgery. And that was very eye-opening for me to really hear patients, their real struggles and their issues with food and how they were really concerned. And so although I haven't walked in your shoes, I like to feel that in my practice, because I do about 80% weight loss, everyone in my office is extremely empathetic to your concerns and needs. And so, I think that, can I directly relate? No, but I mean, we're totally in your corner 100%.
Right.
We're totally supportive. And I think just sort of after doing this for almost 10 years, I know a lot more than someone who hasn't taken care of weight loss patients. And so, I think that's the best way I can sort of answer that.
Definitely. And like I said, I've always felt comfortable. I think you're awesome.
Well, thank you.
So, and then the last, I keep saying the last, but there's just so many questions. And you guys had so many questions. Pregnancy.
Yes.
Obviously, Danny and I would like to have a kid in the next year or two. They wanted to know how it works, if my skin will stretch out, if I can even have a baby if I get this surgery, and all those things.
So, in terms of getting pregnant after these surgeries, it's not necessarily a problem. It's not going to prevent you from getting pregnant, and you're not going to, basically have any issues related to having this surgery. What I tell patients is that if we tighten you up, you're going to have the changes just like any normal pregnant woman would have after surgery. And so sometimes if you've had this surgery and you're going to have kids afterwards, that you may need a revision, you may need a little skin tightening. I do talk to my patients about sort of the timing of pregnancy and things like that. I think that if in the short term you're really thinking about getting pregnant, that we sometimes have a conversation with those patients about is this the best timing, is it not?
Yeah.
But look, I got 3 kids, and I can tell you that if you don't do it at a certain point, you're almost kicking the can down the road a number of years. So I think that's really a personal decision. But it's not going to prevent you from having surgery. From kids. And the surgery is not going to prevent you from having skin changes that may occur just like with any woman, but it's not going to affect your ability to have a safe pregnancy.
Awesome. So one day, guys, but All I know is right now I would rather have no pain, and I'll figure that out later. So the last question I have, and I wanted to talk about this because there is no magic pill, guys. Diet and exercise are key. But after having this surgery, does it help to permanently keep the weight off?
Well, absolutely. I mean, I think, this again is just another tool to sort of help you. And I think patients, again, who have had this type of surgery, really sort of now see the true extent of their weight loss. And I think it sometimes actually makes them work harder because now they see the results. They go to the gym and, they can see their abs now, or they can,
to lift weights.
They're just in clothing and doing things that, just make them feel good. And so they want to almost sort of protect their results even more. And so I think these surgeries are honestly very powerful. They're not necessarily always going to change what dress size you're wearing or pant size you're wearing, and I never make any guarantees like that, but what I tell patients is that how you look in those clothing, how you feel is going to be just night and day. And it's awesome. I mean, I get patients sending me pictures from like dressing rooms trying on bikinis and bathing suits that they never have, or wearing tank tops because they were always embarrassed about their arms, or showing off their legs, and so it's super empowering. And honestly, like for me, and it's sort of why I love taking care of weight loss patients, it's because you're helping patients. And for me, these surgeries not only help patients physically, but they also help them emotionally, and that's extremely, extremely powerful. And it's sort of like what makes my job, honestly, just awesome.
Well, I think that's all the questions. I think we got the majority of them in there. We can always do another one if you guys need us to. Let us know. Other than that, if they wanted to schedule like a surgery with you, can they contact you? Do they contact your office? Like, what should be their next step if they're like, oh, he's a great guy. Lexi, she already knows. I need to talk to him. What should they do?
So I have a website. It's www.josephmichaelsmd.com. There's a lot of information on there for weight loss patients about the different procedures and things like that. We're also on Instagram at Dr. Joseph Michaels, on Facebook as well, Twitter. I sort of don't use as much, but we're there. Exactly. A lot of information there. Honestly, like we love weight loss patients. It's a real passion of ours. And so if you have any questions, patients DM me. They find me. We're very well connected to our patients.
Stalk.
So that too.
Creep on you.
Just because they're not following you.
Not stalk, maybe creep.
What are you saying? Just because they're not following you doesn't mean they're not following you, right?
Preach. All right, guys. But thank you for being here. Thank you for doing this with me.
So
I know
glad
it means a lot to them. Yeah.
It's so cool.
But make sure you guys find me on social, Twitter, Snapchat, Facebook, Instagram, Fatgirlfedup. We will see you guys soon in October.
Coming soon.
Bye.